Hi, this is Michelle and I'm speaking for Group 5B, and today we're going to be talking about hydrogels for infected wound therapy. So the issue our study focuses on is infected wounds, and common causes of infected wounds is trauma, burns, and surgical incisions. Around a third to a half of surgical incisions actually become infected. Staphylococcus aureus is one of the most common sources of infection, and it'll be used as a model bacteria target for today's study. So why wounds are so dangerous is because they often lead to sepsis, which is a lethal inflammatory response by the body, as well as other major infections such as arthritis, osteomyelitis, as well as pneumonia. These bacteria can also produce toxins, which could lead to a decreased wound response, as well as decreased immune functions. There are also other issues outside of just the biological, such as an aging population who are more prone to infection, as well as has a harder time fighting off infections, as well as increasing medical costs, which becomes a burden to the healthcare field. So, of course, there are current solutions to infected wounds, these being antibiotics, which you probably heard of, wound dressings, and antimicrobial hydrogels. But all of these solutions, as of right now, have its corresponding issues, such as antibiotics lead to a buildup of resistance, wound dressings lack biocompatibility, and today we're going to try to focus on antimicrobial hydrogels and try to improve on the issues that they currently have. So the goal of our study is to create an injectable photopolymerized hydrogel with antimicrobial and biocompatible properties, and this was an article found in Nature. So what this article did was it started off with two polymers which had favorable traits, such as epsilon PL is biocompatible and has already been proven to show antimicrobial properties, as well as gamma PGA, which is also biocompatible. It's also water soluble, and it actually helps promote tissue repair. So we're going to delve into how the study was set up. And so it first starts off with these two polymers, and then they shine visible light to actually form the hydrogel. And this hydrogel will be created through different ratios of two polymers and then characterized, and its properties will be assessed. So one of these tests that they do is on a rat, and I'll explain more of this in a couple of other slides. So some of the properties I want to talk about have been highlighted, and I just thought that these would be the most relevant to the class as well as the ones that we're most familiar with. So first, with the preparation of the hydrogel, what they did was they got the two polymers and mixed a couple other reagents in there, and then they should use irradiation of visible light source in order to trigger the actual formation of the hydrogel. They also characterized its swelling ratio, as we became familiar with in lab homework 3, and where they freeze dried the hydrogel to get the dry weight, and then soaked it in phosphate buffered saline to get the wet weight. Then they also performed a rheology test, and rheology is actually the study of flow and deformation. So this is kind of an assessment of the mechanical properties of the hydrogel, and the machine that they use to assess these properties is shown on the right. So they also assessed some biological properties, and they did an in vitro as well as an in vivo test for its antibacterial properties. So for the in vitro test, what they did was they cultivated two strands of bacteria, and S. aureus is actually the one mentioned before, and they seeded them onto these different hydrogels in order to see how many bacteria cells the hydrogels could kill. For the in vivo test on rats, they actually induced infected wounds and then put the mixture of the hydrogels onto the wounds, and then shown visible light to form a hydrogel to see how many cells that killed. And a picture of the in vivo test is shown on the top and also on the right. They also assessed the cell viability, which they used a test that we talked about recently in class, that being the MTT-assay.
Hi, this is Maria Suarez, and I'll be delving into the results and analysis of the paper. To begin with, Figure 3E shows the results of scanning electron microscopy used to investigate the size of the pores in the gels. It was found that the pore sizes in the gels with different proportions of epsilon PL GMA were between 80 and 120 micrometers. This indicated that hydrogels had sufficient pore sizes to exchange nutrients and enable the cells to propagate and migrate, which is needed for survival. Also, figure 3F shows that as the proportion of epsilon PL increased, the gelation times of the hydrogels decreased from 10 to 6 seconds. This can be attributed to an increase in cross-linking density. However, since all of them showed relatively fast gelation times, all could possibly be administered via injections since these fast gelation times are ideal to help the gel reform after being injected. And also, figure 3G shows that as the proportion of EPL increased, the swelling ratio decreased. This can be due to an increase in cross-linking density when the epsilon PL ratio is increased. Moving on to figure 4, as Michelle explained, rheology tests were carried out to inspect the hydrogel's microstructure and mechanical properties. In this case, figure 4 shows that the storage modulus, right here, was larger than the loss modulus. The storage modulus described the elastic response, while the loss modulus describes the viscous response. Thus, a lower modulus suggests that the hydrogel could be easier to inject, which is beneficial for the desired application since it could reduce the need for invasive procedures. Also, a p-value of less than 0.05 suggested that the storage moduli did not vary significantly as the strain was changed. This leads to the conclusion of the hydrogel being homogeneous in nature and having stable cross-linking density. Homogeneity is a desirable property for the intended application since it suggests that the hydrogel is easier to manipulate, control, and maintain consistent. Here in figure 5, we can see that compared to hydrogels without epsilon PL, hydrogels containing epsilon PL GMA showed high levels of activity against S. aureus and E. coli in comparison to the control. Also, the hydrogels with the largest proportion of epsilon PL GMA had the most antibacterial activity, which can be seen by the decrease in white dots showing the bacterial colonies. Moreover, imaging the S. aureus bacteria using SEM showed that the bacteria treated with the hydrogel were damaged, suggesting that these hydrogels possess killing activity against S. aureus through cell membrane disruption. In addition, the hydrogels showed no obvious cytotoxicity, with over 90% of the cells remaining viable. Similarly, live-dead staining in figure 6b showed that the hydrogels caused no obvious damage to 3T3 cells when compared to the control. This suggests that the hydrogels are biocompatible. Finally, figure 8 monitors the secretion of cytokines, which are released during an inflammatory response. The white arrows show the location and amount of IL-6 and TNF-alpha expression, showing lower levels in the hydrogel group. This suggests that the hydrogels could effectively control inflammation and promote wound healing.
Hi there, this is George. To sum up a lot of the results Maria had discussed earlier, this study was looking to investigate primarily three properties of these novel gamma PGA epsilon PL hydrogels. First is antibacterial activity, second is cytotoxicity, and finally its inflammation control. We see that the fourth formulation of the hydrogels performed phenomenally across the board, killing over 99.9% of the two bacterial species in vitro, preserving over 90% of the cells in its presence, and also reducing the activity of the two inflammation indicators versus control. When we compare these results against existing solutions, we see that these hydrogels have on par, if not better, performance compared to the antibiotic ointment, and also better biocompatibility compared to traditional wound dressing. The impact of these results is really that hydrogel seems to be performing better than traditional applications, and it has the potential to become a future standard in wound dressing applications going forward. The next steps after the study really relies on the capabilities of epsilon PL as a material. Its anti-pathogenic abilities extends beyond the two bacterial species and to other species of bacteria, fungal species, and also potentially antiviral activities. We think that an important next step to take is to understand if our hydrogels have the potential to fight against these other pathogens in wound healing applications. And additionally, we think next steps in the research really look to support clinical applications of these hydrogels. With a structure similar to extracellular matrices, hydrogels have been shown to help in skin regeneration. With PGA being also shown to play a facilitative role in nerve regeneration, we think that these new formulations of hydrogels could really have a potential role in skin regeneration, and that should be something that researchers should investigate as a next step. And finally, to allow for clinical applications, we must understand these hydrogels' effectiveness in wound healing within human tissues and in human volunteers. Applications of this hydrogel really is looking at management of large wounds in terms of healing post-organ transplant wounds and potentially burns or large skin trauma. After an organ transplant, patients are at risk because of the immunosuppressants they must take. And common pathogens pose a lot of risk to them, and we think that this hydrogel could really be helpful in managing those risks. In a large burn or skin trauma, we see the hydrogels can definitely help manage the large size of the wounds, but also offer help in terms of pain management and additional skin repair capabilities, as we discussed earlier. And finally, our overall thoughts about this area of research. We see that this is the combination of years of foundational work into materials. Epsilon PL and gamma PGA were chosen for their particular properties in terms of antibacterial abilities and biocompatibility. We think that a lot of more foundational work may be out there waiting to be discovered and integrated into hydrogels, and there's a lot of potential in this field going forward. The efficacy and biocompatibility of our hydrogels also merit further investigation for clinical use. We think that in an era of antibiotics proliferation, novel solutions like these, which do not require antibiotics, should be investigated further and hopefully applied into clinical settings. And with regards to limitations of our hydrogels, we really see that its complex structure and preparation may limit some of the practical use. And NA properties of hydrogels, including the swelling profile and potential risk of exposure to water, also may prevent certain practical implementations. In terms of alternatives, we see a lot of other polymeric applications and innovations to help with wound management, including the dermal delivery of antibiotics through a polymeric film. A lot is being worked on in this field. It is not yet clear which applications may become the standard in the future, but we do see a lot of potential in our hydrogel formulation. Thank you very much, and here are our references.